So let us look at how health is basically measured. This discussion is not going to be in depth, but it's basically to highlight if we are to look at two countries or two populations, how do we decide that this population is having better health status compared to the other? So, what are those indicators that we can use? So, the first is what we call morbidity. This one refers to people who are reporting to be having a particular condition. Okay, so if someone is having hypertension, is basically living with this condition. That is morbidity. So we look at the prevalence and incidence. Those are the two indicators that we look at. So when we talk about prevalence, we are talking about the number of people that have that disease in a given population at a given time. So assuming you have a population of 1,200 people, and then out of those you have let us say 350 with a particular condition, let us say in this case cancer. What could that prevalence be? Okay, so it is the number of people who have the condition, that is 350, divided by the total population, which is 1,200. Okay, so that gives you the prevalence or the prevalence rate. Okay, and then for morbidity, we also look at incidence. We look at the number of people that have been newly diagnosed with a particular condition in a particular period of time. Okay, so it is possible that in a population that has about 200 people, from January to December, you have about 5 people who have been diagnosed with breast cancer. In this case, if we are talking about a population of female, so it's possible. The example that we can look at here is that if you have a female population of 200, and out of these 200, in a period of 1 year, 5 of them actually get breast cancer, then the incidence is calculated by dividing this 5 over the 200. That will be the incidence rate. And then the other area that we look at when measuring health is mortality, which is basically about deaths. The deaths that happen, the occurrence of deaths is what we term as mortality. So mortality rate, we look at the number of people that have died of a particular condition divided by the total number of people in that community or the total population. So if you have 25 deaths that are happening in a population of 300, means 30,000 people, then the calculation is that you are basically having 83 deaths due to lung cancer per 100,000 life, per 100,000 people. Okay, so this 100,000 people is a number that we can use for convenience in order to communicate clearly. But basically, what we are saying is that for every 30,000 people that we are having here, you're having 25 deaths happening. But if we want to make the figure quite easy to communicate, we can communicate using what happens per 1,000 people. So life expectancy is another indicator that we can look at. So this one is about how many years a person is expected to live based on the current mortality rates. Okay, based on the number of deaths that are happening, how long is a person expected to live from birth? And like we said earlier on, higher life expectancy will indicate lower infant and child mortality. Okay.